to thank you. There we go, for joining us today. We are featuring a topic called When It's Time to Stop Driving, How the Driving and Dementia Roadmap Can Help. My name is Susan Oster. I'm a public education coordinator with the Alzheimer's Society Southwest Partners. I will be the MC and moderator for today's webinar. Jess Lawson and Ashlyn Humphreys, also public education coordinators with the Society, will provide our technical support today. At the Alzheimer's Society, our role is not only to provide programs and services to people who are going through the journey of dementia, but also to provide dementia education and to advocate for those living with cognitive disabilities. So before we begin, I have a little business to go over relating to the webinar experience. Please note that your cameras are off and microphones are muted for the webinar. This event is being recorded, and the recording will be available in the future on the webinar archive page of our website. At the end of the presentation, we will have approximately 10 minutes for a moderated Q&A. We will do our best to address as many questions as we can. During the presentation, if you think of any questions for the panelists, please add them to the Q&A box located at the bottom of your screen as you see here. If you would like to submit a question anonymously, please click the Send Anonymously box before clicking the Send button. Should you be having any technical concerns, please type in the chat box and Jess or Ashlyn will be happy to help you. You may need to move your cursor around to see the Zoom controls and icons. You can submit your technical concerns in the chat box and they will only be seen by the panelists, which includes myself, Jess, and Ashlyn. We have also enabled the upvote feature, show you here, which allows people to see all questions being asked and to move the most popular questions to the top of the list. So if you see a similar question posted by someone else, you can simply vote on the question by clicking the thumbs up icon underneath the question. As you see here, once the icon is clicked, the question will move up in the list. So since everyone's situation is unique, the information being provided in this presentation is for educational purposes only. So should you have specific questions about your situation, please contact your support worker. And now I have the great pleasure of welcoming our panelists, and there are 4 of them, so I may ask the other 2 to put their cameras on so we can see everyone. Great, so first up will be Dr. Nagley. He's a professor in the Department of Medicine and the Institute of Health Policy, Management and Evaluation at the University of Toronto. He is the Vice President of Medical Services and Chief of Staff and Chief of the Department of Medicine at Baycrest Center for Geriatric Care. So he is a geriatrician. Dr. Mark Rappaport is a professor and residency program director in the Geriatric Psychiatry Division of the Department of Psychiatry at the University of Toronto, past president of the Canadian Academy of Geriatric Psychiatry, and acting head of Geriatric Psychiatry for Sunnybrook Health Sciences Center. So certainly when you signed up, you can read their full bios there. Next, I will introduce Nanette. So Nanette is a occupational therapist, or OT, with the Thames Valley Family Health Team and has supported local recruitment of participants for the Driving and Dementia Roadmap, or DDR. She has supported our community in her role as an OT with Family Health Team and in local primary care memory clinics. She has co-presented with the Alzheimer's Society about having early and proactive conversations about driving and dementia. And last but certainly not least is my colleague Rhonda Krause. She is a registered social worker and First Link Care Navigator for the Oxford site of the Alzheimer's Society Southwest Partners. She has also supported local recruitment of participants for the DDR research, and she has supported our local community in her role as a social worker in memory clinics, often working with Nanette. And with that, I will pass things along to Dr. Nagley.
Thank you so much, Susan, and thank you so much for the introductions. And Mark and I are so delighted and are grateful to the Alzheimer's Society Southwest Partners for inviting us to give this presentation today. I'd like to begin with a land acknowledgement. I'd like to acknowledge the Indigenous peoples of all the lands that we are on today. While we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the lands which we each call home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. From coast to coast, we acknowledge the ancestral and unceded territory of all Inuit, Métis, and First Nations peoples that call this land home. I would like to acknowledge that I am on the land of the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis. I also wish to acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. We'd like to recognize our exceptional research colleagues. We have co-investigators across the country. Our tremendous research associates, our current one, Elaine Stasiulis, as well as research assistants and research trainees. And we would like to acknowledge funding for this through the Canadian Consortium on Neurodegeneration and Aging, funded by the Canadian Institutes of Health Research and Partners, as well as funding from the Centre for Aging and Brain Health Innovation out of Baycrest and the Ontario Ministry of Health. We'd also like to give special thanks to the Alzheimer's Society's organizations across the country that have supported and participated in this work.
Dr. Nagley, sorry, could you switch your slides over to the presentation view?
There you go. I apologize.
Thank you.
That's better.
That's perfect. Thank you.
Thank you for that. So what we'd like to do over the next little while is give you some background about driving and dementia, talk about the development of the Driving and Dementia Roadmap, which on many of the slides is referred to as the DDR. Mark is going to give you a tour of the roadmap, and we'll speak to you about some of our next steps. So driving cessation is complex, challenging, and an emotion-laden process for people living with dementia, for their family and friend carers, as well as for their healthcare providers. And there are really two elements to it. There's making the decision to stop driving, and importantly, then transitioning to non-driving. And this requires a delicate balance of personal and public safety issues with health and psychosocial consequences that are associated with having to stop driving. This is from the Canadian Outcome Study in Dementia that involved people with mild and moderate dementia. And what this slide shows is that many people with dementia continue to drive. In this particular study at the baseline, 28% were still driving, and many continued to drive for some time. So after 2 years of follow-up, half of those who were driving at baseline were still driving, and at 3 years, a quarter of the people who were driving at baseline were still driving. This slide represents an estimate made by Hopkins and colleagues on the number of drivers with dementia in the province of Ontario. And as you could see, starting back in 1986 to current times, there's a very dramatic increase in the estimate of the number of drivers with dementia. And based on these estimates, we are nearing 100,000 drivers with dementia in the province of Ontario. Now, why is this important? The reason it's important is there have been numerous studies that have been done that look at the driving of people with dementia compared to people with normal cognition. And these studies uniformly show that drivers with dementia have more problems with road rules, with maintaining the lane, with changing lanes, with making turns, especially left-hand turns, maintaining road speed, so driving either too fast or too slow for the speed limit, stopping appropriately, and more difficulty of avoiding collisions. They also demonstrate less attention and slower decision making. Driving performance has been shown to decrease with the increasing severity of the dementia. And 6 of 10 studies that looked at collisions found that drivers with dementia crashed more often than controls, anywhere between 2 and 10-fold. And finally, 15 to 65% failed on-road driving assessments. There's also an extensive literature that looks at the health and psychosocial consequences and outcomes of giving up driving. These include less social engagement and out-of-home activity, more depressive symptoms, poorer general health, poorer functional status, greater decline in cognition, greater long-term care placement in nursing home, and greater risk of death. The other key finding is the extensive and important emotional impact of driving. Certainly in the person with dementia, we note that driving is connected to a sense of freedom, independence, and control. It's not just about getting from point A to point B. Can affect roles in terms of taking care of spouse, children, and aging by providing transportation for them. Can affect issues of work and livelihood, and certainly can affect enjoyment, taking a drive in the countryside. It results in a lot of emotions: loss, sadness, grief, fear and anxiety, depression, frustration, guilt, and anger, often directed at family members and healthcare providers. There's also an emotional impact on family, friend, carers. Things like loss, sadness, and grief, possibly loss of future dreams, certainly results in fear and anxiety, how to cope with the emotions of the person with dementia around this issue, and obviously fear of a crash, a collision, if the person with dementia keeps driving. There's feelings of frustration, anger, and guilt when the person with dementia may be experiencing denial or intense sadness, withdrawal, or anger. They often feel discouraged and powerless when the person with dementia insists on continuing to drive. And finally, at times, they're feeling overwhelmed with the added responsibilities of helping to try to meet the transportation needs or making driving arrangements for the person with dementia who can no longer drive. So there are a number of challenges associated with driving cessation. There's often a lack of understanding about the relationship between dementia and driving. No one likes to talk about driving cessation, and our work has emphasized this. This includes the person with dementia, family carers, but also healthcare providers. Many identified a lack of training and knowledge with respect to the healthcare providers about how to assess fitness to drive, and equally important, how to support the quality of life after the person has to stop driving. There have been few established interventions for dealing with this issue, and we found in our work that resources can be difficult to access, and the credibility of many of the resources are hard to determine. So we undertook to develop a resource to support people with dementia, family, friend carers, and health providers in the decision-making and transition to non-driving. I'm going to go through quickly the next several slides. Just want you to recognize the rigor that we put into this. We reviewed published studies on a number of related issues to the topic of driving cessation and collated this work. We also did a study specifically about studies that did interviews and focus groups of key informants with respect to their subjective experience of driving cessation and dementia, and we collated this work. And we also carried out our own qualitative studies. These are studies where we do focus groups or interviews, and this included people with lived experience and health providers, as well as people who work with the Alzheimer's Society to help inform our work. And the key things that we found is there's a perceived lack of education and resources for advanced planning and decision-making about driving cessation and the transition to non-driving. Facilitating discussions about driving cessation are clearly critical for early planning, with an emphasis on the importance of doing this early, in the very early stages of dementia, so people with dementia can contribute and participate, and promote shared decision making, including, of course, the person with dementia. Addressing the emotional effects of driving cessation are as important as attending to the practical aspects. And this was a quote from a family carer: "The trauma of losing her vehicle, the use of her vehicle, was as traumatic as losing my dad. It was like losing a spouse." And then finally, family friend carers need support in their role of maintaining purpose, roles, and social participation of the person with dementia after they have to stop driving. So we took all of this work that we did, and we brought it together in a driving and dementia intervention framework. And importantly, we separated these into practical components and emotion-focused components. And the reason for this is how much came out during our research about how important the emotion related issues are with driving cessation. And with the practical components, these are around information and awareness about driving dementia, issues around communication and mobility and community access. And with respect to the emotion-focused components, relationships and role transitions, issues around crisis and conflict, loss and grief, and finally, identity and meaning. A next stage of our work is we identified and assessed all publicly available resources and tools that address the issue of driving cessation. And then we undertook an assessment of each of these based on evidence-based relevance and usability, and narrowed it down from 75 tools to 24 tools that we selected. We then curated the tools and resources to align with the driving and dementia intervention framework. We had an advisory group throughout the process. This included 4 people living with dementia and 4 family carers who provided ongoing, critically important feedback on the content of the roadmap as well as the design. We involved a geriatric psychiatrist, occupational therapist, and a manager with driving authority to provide feedback on the healthcare professional portal. And importantly, we involved a plain language writer with experience in developing educational content for people with dementia to help make sure that the language and how we presented information would be suitable and of greatest use for people with dementia. We also worked with web developers and graphic designers. I'm now going to hand things over to my colleague, Mark Rappaport.
Thank you very much, Gary. So Gary has outlined the problem that we're trying to address and the steps that we took to develop this website over a number of years. Before we launched it online, we wanted to make sure we did an okay job and to get feedback on the website itself. So we did something called an implementation evaluation. That means we implemented it, we had people use it, and we sought feedback. So the objective was to explore the near final version of the website's acceptability, adaptability, so how do people use it in their settings, and preliminary benefits and limitations. So we approached 6 different Alzheimer's societies in 4 provinces, and we had 19 staff, 8 current and former drivers who had dementia, and 13 family and friend carers of those people who had dementia. The findings, the preliminary findings that we had were people told us that it was highly acceptable. They found it very useful, enlightening, and absolutely necessary. They found that it brought deeper awareness and understanding about driving cessation, which impacted their approach. So, for example, one person told us they were more diligent about observing warning signs. A family carer said, it's helping me monitor her more. I'm going to make sure that every few months I'll either go in the car with her or follow her and talk to her about it on a regular basis. Someone with dementia told us that it made me realize there's an end to driving somewhere in the future. Actually, I hadn't even thought of it. Somewhere along the line, I know I've got to stop. So these are some selected quotes from that implementation evaluation. They also told us that the emotion-specific content provided insight about grief and loss. This is something that Gary emphasized, came up a lot in our development, that grief and loss and the changes, this is very emotional. Family members told us it helps them attend to the emotional ramifications and initiate conversations in a way that demonstrates empathy and patience. They also told us that strategies to maintain mobility, like to keep active in the community after you stop driving, brought them relief and hope. One family carer said to us, "It gave me a little bit of hope that together as a team with my siblings, we can figure out a plan." So with that, I'm going to show you the Driving and Dementia website. In order to access it on the internet, you would go to www.drivinganddementia.ca. But for today's purpose, I'm just going to show you selected parts of the website. When you type in that URL, drivinganddementia.ca, you'll come to this landing page, and you'll see that we've organized it according to three main portals. There's a portal for someone who has dementia, one for family friend carers, and one for healthcare providers. We'll emphasize these two today. And you could see that underneath each category, dementia and family friend carer, we have an option of I'm still driving, or the person with dementia who I care for is still driving, or I am no longer driving. So we hope that the resources are relevant in both stages. So here's an example. You might want, if you're someone with dementia who is still driving, you might click here, and then this would open up another page that gives you various options of things that you might want to learn about. How can my dementia affect my driving? How will I recognize when it becomes unsafe to drive? How can I get help deciding to stop driving? Other options are getting around without driving, dealing with my emotions, and learning about licensing and reporting and other transportation options. So let's say you decided you wanted to click on recognizing when it becomes unsafe to drive. You'd click there, and a page would open that says, as soon as you have a dementia diagnosis, it's important to keep checking whether your driving is safe. If you notice that changes in your driving, you should start thinking about whether you're able to drive safely. It may become more difficult to recognize that you're no longer able to drive safely as dementia progresses. You might want to learn about how to assess your driving, how others assess your driving, but there's also a video that the Alzheimer's Association in the US provided about a discussion about driving assessment and other ways to get around. This is in the US, and so there's some parts of it that won't be applicable to Canada, but most of it is very relevant about recognizing when it becomes unsafe, and it's an emotional video. Getting help to stop driving. If you click on that box, you may find some information about who to talk to, whether it's someone you trust, your doctor, and some worksheets. This example here, Driving and Dementia and Driving and Decision Aid, is if you click there, it opens up a resource from University of Wollongong, Australia, that has a step-by-step approach about how to make decisions about this very difficult area. There are also tools about warning signs and an agreement with my family about driving, some alternate transportation worksheets as well. Let's say you're someone with dementia who is no longer driving. You would click here to find some additional information. You might want to know about why was it necessary for me to stop? How am I going to get around? How do I deal with my emotions? And again, learning about licensing, reporting, and transportation options. So here's an example of getting around without driving. What we really, Gary and I have a very similar approach to this. We want people to continue living after they stop driving. So we ask them to think of places they like to go and see if any of these options work. Getting there, lifts from family and friends, carpooling, public transits, taxis, ride hailing like Uber or Lyft, lifts from members of the religious organization, considering changing some of your routines. For example, instead of visiting the bank, setting up automatic bill payments, There are worksheet examples. There's a video and there's worksheet examples. Here's one example where we talk about using alternate transportation. And when it says here that when you're looking for alternate transportation, review all options from informal arrangements with relatives and friends to formal public services. So list your family members, their phone numbers when they're available, friends, demand responsive services, private program services, taxi, mass transit. What we want to avoid is having the spouse or one family member be responsible for all the transportation. That happens in 90% of the time, and that's not fair for that family member. It also makes the person with dementia feel pretty badly and guilty, and that's unnecessary. There's often other solutions that we encourage people to think about and look at.
Sorry, Dr. Rappaport, are you able to make your screen a little bit bigger?
Yes.
That would be wonderful. Oh, perfect. Thank you. That's great. That's
okay,
wonderful.
I'll just go back there to show that slide. It might be easier to see now that the screen is bigger. This says telephone availability, destination, cost, and pros and cons. So it's a worksheet that you can use to work together with your family member, with your family who's caring for you. You can do it on your own. This is an example. I'm a family friend caring for someone with dementia who is still driving. Again, lots of options. Why was it important to give up driving? Recognizing when why will it be important? Recognizing when it's going to become unsafe, having conversation about giving up driving, transition and planning, dealing with emotions, and what happens when my loved one with dementia won't stop driving. So here's an example about having conversations. We have some text here. I'm not going to read through the entire slide, but we want you to think about how to communicate. There's a conversation planner worksheet that may be helpful. How can I have good conversations about not driving? Positive conversations. So here's some examples. Who should be the messenger? When is it a good time to talk? What are the key conversation points? What do you want to accomplish? Try to focus on one or two key points at a time. The conversation planner really emphasizes that these conversations aren't a one-time thing. They're something that evolve over time between the person with dementia and their family member. There are videos as well. There's a worksheet about not going it alone and how do you identify all the people who can provide support. Gary mentioned that we want to know about typographic errors. I just found one. It was produced by the Hartford. We meant to say it was produced by the Hartford. So when you use the website, there is a button at the top that invites you to provide us feedback, make suggestions for change. We welcome not just typographic corrections, but any things that you think might be helpful. So sometimes someone with dementia, they just won't listen to their family member. They won't stop driving. And there's a number of things you can do. There's some video ideas that you can learn about, some videos to watch. There's a model, Teepa Snow, who's an occupational therapist in the United States, did a seminar for people with caring for loved ones with dementia, and gave some strategies about how to talk to people about driving and what to do. If you're a family friend care working with helping a person with dementia who's no longer driving, there's lots of issues there. One example that you might want to learn about is dealing with emotions. So you would click there, and there's some content here about loss and grief, recognizing that driving fulfills various emotional needs, coping with the emotional impact on you, managing the emotional impact on the person with dementia. There's a worksheet about not going it alone, helping identify who can offer additional sources of support, who is the person, how can they help, and what are some realistic helpful changes that could arise. For healthcare professionals, we all have a lot to learn. Even though Gary and I do this a lot, we learn about this all the time, and we thought to put something together to help people who are healthcare professionals learn about assessing fitness to drive. We hear from patients with dementia and their family members that often their family doctors don't know what to do. They don't know how to discuss it. So we hope that this will provide some information. So this is very text heavy, but what I wanted to show you here today is that it shows us an 8-point step-by-step approach for a healthcare provider to assess fitness to drive. Some family members may find that interesting to read about what is the best practice for healthcare professionals in doing this. Learning about reporting and licensing options. The rules differ all over Canada. Ontario has a very specific rule where doctors must report people who have cognitive impairment that's significant enough to affect daily functioning. We have no choice but to make that report. It's a mandatory report, but there is discretionary reporting for conditions like dementia that don't impact yet significantly on activities of daily living. For example, if the physician and family member are concerned about someone with dementia having hallucinations while they drive, or someone with dementia being very slow, or someone with dementia who is actually in the very mild stage but having car crashes all the time. This is an option where there may be a need to make a report, even though it doesn't meet the legislation. So it's called discretionary reporting in Ontario. So what we have here on the website, healthcare professionals can click on any of these links and find out what the rules are in their province or territory. So next steps, we launched this just over a month ago on October 19th, and we want to know, how is the Dementia and Driving Roadmap website taken up? How is it used? How is it adopted? And does it help you approach and manage driving cessation? Does it help if you haven't stopped driving? Does it help you make that decision? If you have stopped driving, does it help you continue to live and improve your quality of life? So we'll look at Google Analytics, which is just a software that allows us to see who's using the website, not by name, of course, but it allows us to see how many people are using it, what pages they're looking at. There are surveys embedded in the website. If you'd like to give us feedback, we'd love to hear from you. We'll be approaching people with dementia, family caregivers, and healthcare providers for interviews about the use of the website and what people think about it. We do, on the website itself, there is a link to complete a survey to give us feedback about the actual website. If you're interested in more information or you have other feedback, please don't hesitate to email us. We're also doing a study of self-driving cars, autonomous vehicles. People often tell Dr. Nagley and I that this is an area in the future we won't need to worry about driving with dementia because cars will drive themselves. So we're not sure about that. So we're doing a study. We have a driving simulator in Toronto. If you have any clients, if you're a healthcare provider, or if you yourself are anywhere near the Toronto area, to ride a driving simulator that simulates a self-driving car, we'd be very eager to hear from you and include people in a research project about that. Or if you want to give us more detailed information about the website, we'd love to hear from you as well. Thank you very much.
Thank you. So I think we'll be passing the torch over to Rhonda and Nanette. And Rhonda, I see you're going first.
Okay, great. Thank you. Thank you, Dr. Nagley and Dr. Rappaport. My name's Rhonda, and I'm a social worker at the Alzheimer's Society Southwest Partners, working at the Oxford County site located in Woodstock, Ontario. And I'm here today with my colleague, Nanette Bowen-Smith, who's an occupational therapist at the Thames Valley Family Health Team. And we're just here to give the local voice and local perspective to this difficult topic. Nanette and I came to this work together as we started to work in memory clinics locally, and started to be part of conversations where quite often the first time driving was talked about with someone was when they were offered a diagnosis of dementia, and driving had to be addressed, and there were these really difficult emotional conversations happening. And so we recognized the need to have earlier conversations, to reach out to our communities and to encourage older adults to be thinking about driving cessation before that time when maybe a physician had to make one of those mandatory reports. So it's challenging and it's a complex topic, as Dr. Nagley and Dr. Rappaport have mentioned, and we certainly recognize in our local community that there is a reluctance to talk about it, not only among older adults, but among healthcare professionals. So we're working hard trying to encourage those conversations locally. So Nanette and I present a talk called Let's Talk About Driving. And in the conversation, we talk about not only dementia, but we talk about other healthcare conditions that affect older adults that can impact their driving. And this toolkit will be really helpful in those presentations to be able to direct people to sort of one concise resource. It's credible and up to date about the topic of driving and dementia, rather than these pieces of information in different places. Of course, we always want to support persons living with dementia to make individual choice and decide themselves about when the time is right to stop driving. Of course, sometimes because of the lack of insight, or we talk a lot at the Alzheimer's Society about a word called anosognosia. So this is when a person living with dementia might not be able to recognize the difficulties that they have and might not have insight. And those conversations in particular are really difficult for families, because then they're in a position to need to manage risk and to support the person to stop driving. And so we're here to support care partners as well as people living with dementia with these complicated and emotion-laden conversations. We also, as a team of social workers at the Alzheimer's Society, are well suited to talk to people about the grief and the loss that's associated with giving up driving. And we know our local communities fairly well, so we're able to help people to brainstorm about ways to maintain community mobility. I noticed in the chat there's a question, a comment made about some of the more urban centers having more transportation than rural areas. And certainly that's the case in my experience. Sometimes stopping driving means that people start to think about moving. And so if you think about the emotions involved with not only driving, but also potentially moving, it's a huge topic. Lots of times in rural communities, the informal support systems, so the local communities, the neighbors, the friends, are often the alternate sources of transportation. But we also look to places like in our region, the VON offer a volunteer transportation service. Our little community of Tilsonburg has a TGO community bus that travels around, as well as we're fortunate within the city to have the city bus. And people that can't take the regular city transit can qualify for paratransit. And sometimes people need paratransit for cognitive concerns related to managing the bus route, not so much for sort of the way we typically think of paratransit, in that it's for people with physical disabilities. So sometimes we're helping people connect with those options in the community for alternate ways to get around. So if this is something that you're thinking about, you're struggling with, we encourage you to reach out to the Alzheimer's Society locally. I know that Susan will post information about how to do that toward the end of the webinar, and we look forward to talking to you more about that. I'm going to invite Nanette to come forward now and speak about her role as an occupational therapist locally.
Hi everyone. As Rhonda said, my name's Nanette. I'm an occupational therapist with the Thames Valley Family Health Team, and myself and other healthcare professionals have been collaborating in the London, Middlesex, and Oxford and Elgin counties with primary care physicians and the Alzheimer's Society for many years now as part of memory clinics. As Rhonda indicated, that led us to realize that oftentimes those difficult conversations about driving were happening probably not at the best time at an emotionally laden time when a diagnosis was being given. And we, as occupational therapists particularly, we work closely with people around maintaining or restoring their ability to complete those activities of daily living that are important to them, or activities of daily living that they need to do in order to complete their day and get through their week. Things that we would normally take for granted, I think, that start to show up if there's a medical condition that impacts our health. So we realize that sometimes that sense of loss when we're having a conversation about driving cessation, and often as occupational therapists, our focus is really to try and see if we can maintain people's independence as much as possible. So we're very closely linked with having that conversation. But as Rhonda indicated earlier, and it is a difficult conversation and very emotionally laden, and being able to have that conversation early, and sometimes even before dementia is even discussed as a possible diagnosis, just having an early conversation with people so that they can start to kind of process what that might look like as things progress. So today we were talking about dementia and driving cessation or retirement from driving. But as Wanda indicated, there's many reasons why an older adult may choose to stop driving, or why the Ministry of Transportation may suspend or revoke an older adult's driver's license due to medical reasons. And that may not be dementia, as I mentioned. It could be to do with vision loss, or it could be to do with the loss of a physical ability due to a health condition. And one of the things that came up a lot for healthcare professionals, we do an assessment to determine if the impact of the symptoms of dementia could or maybe impact their ability to drive safely. And oftentimes the people with dementia or their family or caregivers will indicate that it's the doctor that's taking away a license. And we're always trying to do that education piece, and having a resource like the Driving and Dementia Roadmap is really important, because it outlines very important information about things like only the Ministry of Transportation can revoke or suspend a driver's license in Ontario. But they do rely on medical practitioners, primary care physicians, nurse practitioners, nurses, and occupational therapists or others, social workers, to advise if a medical condition may impact a person's ability to drive safely. And that's at any age, so not just older adults. And it is often in our clinics where that early assessment happens, and the identity that the possibility of a medical condition could be impacting a person's ability to drive safely happens. We identify it at that stage. But that's only the early stages. And as the Driving and Dementia Roadmap indicates, there's lots of resources out there for individuals and family members to also consider how they're determining how somebody's ability to drive may be being impacted. The Ministry of Transportation also has very comprehensive licensed functional driving assessment centers, considered the gold standard for assessing fitness to drive. And we often emphasize too in our conversations that age itself is not a reason for stopping driving, but we realize that as we age, we often have medical conditions and sometimes more than one medical condition that can impact our abilities. Those symptoms of those medical conditions could be dementia, could be diabetes, could be a number of different things that can impact a person's ability to drive safely. And the Driving and Dementia Roadmap goes through some great resources as to what those symptoms might be and how they could impact people's ability to drive. Having that resource for people to access, which is non-confrontational, where they can do it in the safety of their own home with a friend or family member, reviewing and discussing, it opens up that door to much more rich conversations and early conversations, which is really important. To address that emotional component that comes with having a conversation about retirement from driving. So Rhonda and I do a public presentation, as she said. Initially it was called Let's Talk About Driving and Dementia, and really to emphasize again the earliness of that conversation, or having those conversations with anyone and everyone, is really important. And so we changed the presentation's name to Let's Talk About Driving, so that our clients didn't feel like they had to have a diagnosis of dementia to start that conversation, and that our primary care providers that we service and other people in the community didn't feel like there needed to be a diagnosis in order for that to happen. And we've been able to recruit participants, as Rhonda indicated, to go forward and do some research with the Driving and Dementia Roadmap. And prior to that, we had resources, but they were fairly patchwork and ad hoc. And it has been great, and we're very thankful for the Driving and Dementia Roadmap as a resource that is comprehensive and also kept up to date, as we can use it quite reliably to kind of enhance that resource when we're having those early conversations and direct people with dementia, older adults, and their family and caregivers to access that resource. So yeah, thank you very much for allowing us to share that information, and we're certainly sharing it far and wide as we realize the importance.
So thank you to all of our panelists, and thanks to all of you for your great work on this amazing resource and bringing it to fruition. I know it's been a long time, as you said, in the works, but we're happy that it's out there now and folks can interact with it and you can get some feedback on it. So we do have some time now for questions, and just a reminder to add your questions to the Q&A box and not the chat. And if you see a question that you are also interested in, please click on the little thumbs up underneath, and that will bring it up to the top. I do have a question to start with. I think I'm trying to recall which doctor I heard speak about this at a previous webinar around the issue around insurance, and I know that has come up around insurance implications. If one of you could speak to that, that would be wonderful, because I'm sure it's something that people think about and ask about all the time.
Thank you very much for that question. So I was preparing for a talk a year or two ago, and someone had asked in advance. So I spoke to the Insurance Bureau of Canada to specifically ask the question: if someone is, for example, is given a diagnosis of dementia, what is their responsibility as it relates to the insurer? So what I was told is that virtually every car insurance policy have certain what they call boilerplate clauses, which are clauses that or generic clauses that would appear in just about every driving insurance policy, that would state something to the effect that if you develop any condition that may impact your driving, it is your responsibility to make the insurer aware of this. I would suggest that most of us are unaware of such a clause and probably don't know and don't let their insurer know. So that's what I found out. So you can look at the small print, which many of us don't do in our car insurance policies, to see if indeed there is such a clause that will confirm to you that if you develop any medical condition, not just dementia, it could be some type of eye disease or other conditions, that you may have to let your insurer know that you've been diagnosed with this particular condition.
Wonderful, thank you for that. I'll go to our few questions that have been asked, and I think this is probably most directed to Rhonda and Nanette around the question around confidentiality.
So read the questions. Assume discussion with your team members is confidential. So certainly when when somebody calls to meet or to talk with me as a social worker, our conversations are confidential, but there are certain limits on that confidentiality that would be described to you or outlined to you before we talked further. Certainly on this forum, the discussion is not confidential because it's open to the public, and anybody could be logged in and see the conversation. So I don't know, Dan, if you are connected to the society, you're welcome to reach out to me, or if you're connected to the family health team, you're welcome to reach out to Nanette, and we can talk to you more about confidentiality in your specific situation.
Right, thank you. So, Rhonda, you mentioned this in our local area around, someone has asked about tips, or has there been research into options for those living in rural communities? So maybe I'll put this out to the doctors about the work that they did. I know you worked with a number of societies across the country. If this came up and how you sort of address that and how you put the package together for the online resource.
Yeah, so thank you. We know that that this is much harder in rural communities. Alternate transportation is very hard. It's hard urban, but it's much harder in rural communities. A lot of the options that exist in Toronto, for example, don't exist closer to where you are. And that can really have a major impact. We're told this time and again. Our next phase of our work is going to have to really focus in on this. We have been meeting with rural caregivers in Saskatchewan and learning some very interesting things from them, including some positives that we hadn't anticipated hearing, some things that are positive in rural communities that we don't have in urban ones. But I think we really need to pay more attention to rural. So I know that's not a definitive answer, and Gary may have some additional.
Yeah, if I could just add to that. So most certainly we're very aware that certain transportation options that are available in urban centers would not be available. There may be no taxis, there may be no public transportation. Now, what may be available in rural communities that's not available in urban centers is a sense of community. And because different rural communities are so different, I think those discussions need to be had at the level of that rural community in terms of what the community might be prepared to do to support someone who can no longer drive. Certainly, we've heard stories that neighbors and even people who don't have a particular social or close relationship with the person with dementia actually volunteer as well to provide some transportation and support. And as Rhonda said, I mean, the unfortunate reality is in some rural communities, the decision to have to move may need to be made, because obviously in those communities, distance to healthcare, distance to medications or to grocery shopping may be far and difficult to attain. And if the local community cannot come up with a plan to support them, or they don't have local community services that offer rides, they certainly may have to consider moving, which is obviously extremely unfortunate, a real challenge and burden for someone in the context of having a dementia and having to give up driving and various other losses, but that can be a reality in certain circumstances. And certainly Mark and I have a real awareness of this and a commitment to look into this further. But, we have to be candid and frank that there's not going to be a magic solution for this challenge in rural communities. But certainly, at least giving it some emphasis and recognizing the challenges can be important as well.
Can I just add as well, I do think that the resource that you have on the Driving and Dementia website, that transportation plan, is so important, and we emphasize that in terms of having that discussion and not leaving it up to the person with dementia to organize their own transportation, but to sit down and help them plan, so that instead of having to make a call arrange a trip somewhere or to arrange something, that's all pre-planned, and that the family member and the caregiver help as that organization piece. But that tool is really helpful to kind of really identify who's going to be doing what, you know, and really coordinating and making it a community effort, and so that the person who's dealing with that change in their circumstance, in their ability to do that particular activity of daily living, has the support to be able to move through that. So whether that's rural or in urban centers, that's been really helpful to identify, and that tool is really helpful.
Yes. I'm going to just address, Dan wrote a question about discretionary reporting. It does apply to physicians. It also applies to occupational therapists in Ontario. They have discretionary reporting. It does apply to all medical diagnoses that may have, as long as it's affecting driving. So if there's a medical condition that's not on the official list of mandatory, but the healthcare provider is concerned, there is in a sense, a duty to make a discretionary report, or it behooves one to do that. And then Megan Geddes writes about these a cognitive assessment to determine fitness to driving. So after someone is reported, if the person wants to appeal this, they have to have their healthcare provider complete a form that says that their cognition is fine, no problems, no concerns. And if the healthcare provider gets one of these and is asked to do this, my only advice is that I answer honestly. If I don't know, I say I don't know that this person's safe to drive, and in many cases I would recommend an on-road test. If the person, the scenario that was provided in the chat or Q&A was about someone who's got a mild dementia who actually doesn't do too poorly on areas on cognitive assessment. So that means that the dementia must be fairly mild. And if I'm not sure, then I recommend an on-road test.
Just to add to what Mark is saying, no individual cognitive test or even group of cognitive tests alone at the individual level is sufficient to make a decision about fitness to drive. It's information. It may raise concerns about driving, but in and of itself, and I'm sure Nanette will not disagree with me, driving is a functional task. So the only way to establish if someone is safe to drive or to do a functional task, you have to assess them doing the functional task. And there are all kinds of reasons that certain people may perform poorly on certain tests: education level, English fluency, cultural background, etc. So it's just part of an assessment that can inform you about possible risk, but in and of itself shouldn't. Now, there may be only one circumstance where, like, if there's a person that you do not think there are additional factors that should impact their ability to perform a cognitive test, and if they score so poorly and consistently, and there's a history that supports that there are many activities of daily living that they cannot do because of cognitive problems, that is a different story. They may already have passed the point of no return, that they're already unsafe to drive. So that may be one circumstance that the performance on cognitive tests, in addition to the history of their function related to cognition, may say, you know what, this person is too impaired to drive. But in the milder parts, it just informs you of possible risk. But then generally you should be referring them for a functional driving assessment with someone like Nanette to inform you whether they in fact remain safe or at this point are already unsafe to drive.
So, sorry, Nanette, I'm just mindful of the time, and I know Dr. Rappaport has to jump off, so I wanted to thank all of the panelists. And again, this is being recorded. Please check out the resource, provide feedback, and I'm sure a lot of answers, you'll get your questions answered on that site. So thanks to all of our panelists.